Hello, everyone. I'm Helen Murphy at the Guysborough Journal, and today we're going to talk with Central Nova MP Sean Fraser about the federal government's response to the COVID-19 pandemic and what he's been hearing over the past 4 or 5 weeks from local constituents. Hello, Sean, and thanks for taking some time to talk with us today.
It's my absolute pleasure to be with you. Thanks for engaging in this sort of new format.
Well, Sean, I have to ask first, how are you and your family doing? I think like the rest of us, there's challenges around being in lockdown mode. How's it going there?
We're hanging in there together. I feel like we're very grateful to have the opportunity to be in jobs where we can work from home. There's positives and negatives to everything. I think I'm getting a little bit more time with my family than I'm accustomed to, which is lovely. But it does get in the way of your productivity somewhat. So we're doing our best to making sure we can continue to offer the same level of service people have become accustomed to over the past few years, even though we're doing our best to provide that service from inside our own home.
Right. And I was really curious about, not that long ago, you were appointed as Parliamentary Secretary to the Minister of Finance. Now, often those parliamentary secretary roles, they require sometimes standing in for the minister at events and different things that you're helping out with. But they might not, threaten to take over everything. As your particular role at this particular time, I would think that must be quite daunting as the government's in rapid response right now.
Yeah, certainly it is. It's in some ways it's invigorating, it's exciting, and it's interesting, but for all the wrong reasons in some ways. When you think about the magnitude of the economic challenge before us, you realize very quickly that there's real human beings, community members that live next to you, that you grew up with, that are really hurting right now. So my role as the parliamentary secretary to the Minister of Finance has me engaged in helping formulate the economic response. And not only with the initial rollout of some of these bigger income support policies, but also with the tweaks that you've seen going along the way. Because one of the tasks that I'm helping with right now is making sure that we identify the gaps that people may fall into if the initial policy design wasn't landed properly. And I've been very encouraged because when we hear feedback, I'm seeing the government move to address that feedback more quickly than I have ever seen it before.
And there were some more tweaks, as you mentioned, made this week. Do you feel with the emergency response benefit in particular, do you think we're just about there in terms of addressing those people who are falling through the cracks a little bit?
I think we're most of the way there. I think there are still some groups of people that I have concerns about that do need additional support. Whether that's through that program or through another means is not necessarily. There's not necessarily one right answer. You want to make sure that people are supported regardless of what mechanism you use. So the Canada Emergency Response Benefit, as I'm sure you're aware, is designed to provide income support to those who've had their income interrupted as a result of this pandemic. Some of the changes that we made this week, including allowing you to earn $1,000 while you still collect this $2,000 monthly benefit. The reason that we needed to make that change is we were hearing from people like physiotherapists who needed to make that appointment for a patient who really needed their help and can do it virtually. That one appointment a month shouldn't exclude them from claiming a benefit when they've lost all their other income.
Right.
There's a lot of people in our communities who work 2 part-time jobs and may have lost one of them. There's others who are performers that may not be able to perform in a crowded bar or at a theater, but can still offer a piano or guitar lesson online to a student in their community. We wanted to make sure that we didn't exclude people who've lost the lion's share of their income. So we've allowed a $1,000 earning while you can still claim the benefit. A few other changes that are really important for our communities, including making eligible seasonal workers who didn't necessarily lose their work because of this pandemic, but can't start work because of this pandemic, and people who are on EI right now or recently exhausted their benefits, who are in a similar position to seasonal workers. They may not have lost their job over the pandemic, but can't start work because the job market is so poor. There's still some work to do, particularly around students who are in a similar position but have some unique needs, and we're working to fill that gap right now.
Terrific. And there was also some changes this week. There were some changes to help fit more businesses into the emergency benefit for businesses. Why was that necessary? I think the bar was lowered a little bit on the payroll amount.
Yeah, it was. And this is really important. The new Canada Emergency Business Account is designed to help businesses deal with the ordinary costs of keeping the lights on or allowing them to open the doors once this public health emergency passes. We heard initially that businesses needed access to some sort of cash because they've lost all their revenue and can't pay the rent. We created the new Canada Emergency Business Account, which is up and running now. There's been over 200,000 businesses in the past week have actually accessed funding through their local financial institution. It is government money being administered by the banks in this case. One of the initial criteria was that you had a minimum payroll threshold of $50,000 and a maximum payroll threshold of $1 million. We heard primarily from really small businesses or seasonal businesses saying, because I only have one part-time employee, or because I have seasonal workers who earn a good living, but only work for me for 10 weeks, my business doesn't have a payroll of $50,000. So we lowered that threshold to $20,000 to bring more businesses into the program. Similarly, we increased the 1 million threshold to 1.5 million because there's actually quite a few larger restaurants across Canada that have a lot of staff, but are in the same position as a relatively small business that may have a large payroll, but have the exact same needs that so many other small businesses do. With these changes, there's going to be thousands upon thousands of additional Canadian businesses that will qualify and help them float through this very difficult time and hopefully press the reset button more quickly once the public health emergency is behind us.
Right. And of course, across Canada, the brunt of this tragedy really is being felt by residents of nursing homes, in some cases, staff of nursing homes and their families. Nursing homes are provincial responsibility, but a lot of people are really voicing concern now that they'd like to see, as we eventually emerge from the pandemic, that there's a bit of an overhaul of how we do elder care in Canada. Is that something, even though health falls into a provincial mandate, is that something that the federal government would prioritize collaborating with and supporting?
So I think there's sort of two angles to this question. One is, what do we do now, and what do we do in the long term? I think in terms of what we do now, we have to make it an absolute priority to make sure that the seniors living in long-term care are safe, and importantly that the workers, which you quite appropriately signaled, have access to a safe work environment and are provided with the personal protective equipment they need. We've helped a number of industries rejig their production so they can actually contribute to this effort. And we're starting to see millions of pieces of personal protective equipment be delivered to our national stockpile day by day now. In addition, we made an announcement just yesterday that we're going to be working with the provinces to provide a top up of pay for people who earn less than $2,500 a month and but work in an essential service. I'm thinking long-term care providers would be a great example.
Mm-hmm.
So there is some negotiation to be done with the province. To your question, this is a really big opportunity in my mind that we should take advantage of. There's a number of big questions about what kind of a Canada do we want to live in after this pandemic has passed. Long-term care provides one opportunity for us to say, did we really have this right going into this pandemic? I would suggest it's been made quite obvious that there are serious problems with long-term care in Canada and seniors care in Canada. We've made a number of investments over the past several years to improve in-home care for our seniors by providing additional financial support to the province. I think that's a good start and a good place to kick off the discussions on the back end. But the real conversation about what kind of a Canada do we want to live in is not limited just to long-term care. I think we've highlighted the fact that there's employers who don't have access to sickness benefits. They have no social protection should an emergency beyond their control interrupt their ability to earn revenue. These are some pretty serious questions about what kind of social protections do we want to have exist in Canada. And I think we would be foolish to ignore the opportunity we have to fully consider the opportunities of how to build a stronger Canada. I don't think we need to tear the walls down. I think Canada is built as strongly as virtually any country in the world right now. But it is a place that we should aim to continuously improve. And I think this pivot point provides an opportunity for us to say, how can we strengthen the country that we love so much once we get through this global pandemic?
Right. And, Sean, we've been in lockdown, I guess it's a little over a month now. I'm wondering how the concerns that you're hearing from your constituents in Central Nova might have evolved over that time. I mean, things are rapidly changing. And from what you were hearing from the beginning to maybe what you're hearing in recent days, what are the issues in recent days as we try to finesse some of these programs and assistances that are out there? What are you hearing lately from your constituents?
I could give you 1,000 different answers, but the sort of opinion of the masses in terms of what I'm actually hearing has sort of shifted over time. I think at the very outset of this, a lot of people were saying, look, is this serious, or is this like something that's going to blow by after 2 days? It seems like there may be an overreaction. And then I saw an immediate pivot to extraordinary fear or concern that we might be careening into the next Great Depression that may last several years, where the entire community will be in breadlines, and we may not have banks or homes to go to. But now I see people have recognized that it's serious, but don't feel the same level of despair that I think they did for a few days at the outset. Now that they see there are certain government programs that will support them, even though they may have lost their source of income, I think people are starting to feel comfort that, you know what, this might be a tight few months, but Canada will look largely the same on the back end of this as we did going in. And I think they take some comfort in that. The concerns that I'm actually hearing about now are usually driven by a person who says, you know what, I think I'm the kind of person that might need support. I'm not sure that I fall right inside either the small business account loan program or the wage subsidy we put out there for employers or the emergency response benefit for individuals. And there's people who are saying, look, I'm worried about my situation. I may not have had to leave work, but I'm worried that I will have to. Am I going to be covered? For seasonal workers, we're hearing things about some gratitude that they've been brought into this program on the front end, but they're worried because oftentimes their seasonal income is meant to last them 12 months, and the benefit we've announced currently exists for only 16 weeks. So there's little nuances like that I'm hearing about, but depending on your own life experience, what industry you're involved in, the concerns are quite varied. But generally speaking, I think the tone of the messages I'm hearing right now, people are saying, you know what, because the government has stepped up, I think that I'm probably going to be able to float through this difficult time. It's not going to be easy, but I do think that there's going to be light at the end of the tunnel once we get through these next few weeks or couple of months, depending on the public's response to the public health advice that we're all receiving.
Right. And I think you're probably hearing too, a lot of people are wondering when we're going to get back to normal. Of course, I think the answer might be that it will be a new normal. The normal that we knew before the pandemic might never actually be quite the same again. And there could be a good side to that, as we talked about how we do elder care in Canada, as an example. But I think when we hear from the experts, it's likely that there will be some kind of phasing in. What are your thoughts about the months ahead in terms of what people might expect to see in terms of a lifting of restrictions?
So the only place to start this conversation is to remind people that we are collectively in control of how quickly this public health crisis passes. If we follow the public health advice and practice social distancing, wash our hands, self-isolate where appropriate, we will come through this more quickly and more fully than would otherwise be the case. So follow the public health advice, please, please, please. But if we follow the public health advice, I think you're right to suggest there's likely going to be a phase in of sort of normal social and economic activity. Of course, people will be able to work in a factory or outdoor setting where they don't need to be right next to another person more quickly than you're going to see restaurants and movie theaters open back up. I do anticipate that if we get through this public health crisis, over the summer, you're going to see some normal activity, but it might be a little bit more time than we'd like to before we're shaking hands and in close quarters with others. I do think eventually we will get back to what truly feels normal. But in the interim, I think you're going to see a phased-in approach where certain kinds of less risky social and economic activity come online first. And there's a big geographical element across Canada and even within Nova Scotia. When you look at the concentration of cases in downtown Toronto or Calgary, may not be the same as rural Nova Scotia. So it's possible that we could be earlier or later than other parts of the country in terms of our return to normalcy, depending on the strength of our public health response.
Right. Well, thank you so much, Sean, for taking some time to talk with us about this today. And we will try and touch base with you from time to time. We're in this for a bit of a long haul. So we wish you and your family safety and wellness as we go through it, and we'll reconnect for sure.
Thank you so much. And to anyone listening, please don't be afraid to contact our office. We are still open, even though the offices are physically closed. You can reach us at Sean Fraser MP on Facebook, or if you Google my name, you can find our email and phone number. We are still fielding daily calls and emails, and I encourage you to reach out if you have an issue you want to discuss with our team.
Thank you so much, Sean.
My pleasure. Thank you.
Bye-bye.